Hello again. Welcome to the third part of First Aid for Medical Emergencies. In this part, we'll be covering bleeding and fractures. There are three different types of bleeding: arterial, venous, and capillary. Arterial bleeding is when there is bleeding from the artery. The artery is the blood vessel that carries blood away from the heart to the rest of the body. With this type of bleeding, the blood is bright red in color. A person can lose a high volume of blood, as this is the most serious type of bleeding. Venous bleeding is when a person bleeds from a vein. Veins are blood vessels that carry the blood to the heart. As a result, it's more blackish in color and it flows in a steady manner. Capillary bleeding is when there is a rupture in capillaries. Capillaries are the small blood vessels. Blood loss in this type of bleeding is usually slight and is easily controlled. The key first aid treatment for all of those types of bleeding is direct pressure over the wound. Management of bleeding. With open wounds, there is a risk of infection, so wear gloves to prevent yourself from any infection. Apply direct pressure to the wound using a sterile dressing if possible, or a clean cloth to stop the bleeding. Call for emergency help or ask someone to do so. Secure the dressing with a bandage to maintain pressure on the wound. Make it firm enough to maintain pressure, but not so tight. Check the circulation beyond the bandage. Check the pulse in the wrist. Place 2 fingers on the thumb side of your wrist. If you don't feel the pulse, then you need to loosen the bandage. The loss of blood could cause the patient to faint, so you might need to let the patient lay down and raise his legs to keep it above the level of the heart. If bleeding shows through the pad or dressing, do not remove it and apply a second dressing on the top of the first. Support the injured part with a sling or bandage. Keep monitoring the patient's level of response until help arrives. True or false? To stop a nosebleed, lean the head back and apply pressure to the nose. False. A common first aid mistake is that you should lean back if you are bleeding from the nose. This could be dangerous as the blood will run down the throat into the stomach, causing sickness and vomiting, and even in some cases choking. Nosebleeds can be frightening, but they aren't usually a sign of anything serious and can often be treated at home. Common causes of nosebleeds include blowing your nose very hard, a minor injury to your nose, changes in humidity or temperature. To stop a nosebleed, sit down and firmly pinch the soft part of your nose, just above your nostrils, for at least 10 to 15 minutes. Lean forward and breathe through your mouth. This will drain blood into your nose instead of down back your throat. Place an ice pack on the bridge of your nose. Stay upright rather than laying down. Seek emergency care if the bleeding continues for longer than 20 minutes. A break or a crack in a bone is called a fracture. There are 2 types of fractures: open and a closed fracture. In the case of an open fracture, the broken bone may pierce the skin surface, so you'll be able to see the fracture. But in a closed fracture, the skin around the fracture is intact and you cannot see the broken bone. So how can we know if someone is having a fracture? Here are the signs and symptoms of fracture. Swelling and bruising around the fracture. Deformity. You might notice that the affected limb looks shorter, twisted, or bent, along with pain and difficulty moving the area. The most important thing when it comes to fractures is not to move the person unless you need to, in order to avoid any further injury. True or false? Do not attempt to force a broken bone back into place. True. Do not try to push a bone that is sticking out back to its place, as this could cause further injuries to the underlying tissues and blood vessels. Management of fractures. Advise the person to keep still while you support the injured part to stop it from moving. Do this by holding the joint above and below the injured area. If there is a wound, cover it with a sterile dressing or a clean cloth. Apply pressure around the wound and not over the exposed broken bone to control any bleeding. Then secure the wound, secure it with a dressing or with a bandage. Place padding around the injury for extra support. You can secure the broken bone with a sling as shown in picture 3. Finally, monitor the patient's breathing and level of response while waiting for help to arrive. Thank you, and see you in the fourth part of this presentation.